So good evening to everyone and welcome to today's session. I hope the online students have no issue with the voice. Now, Guyon's canal basically contains which important nerve is a very important question. Ulnar nerve, one of the classical questions. Medial pterygoid, what is the function of the medial pterygoid? It closes the jaw, but the trick of the question is it the main trunk, is it the anterior branch, is it the posterior branch, is the leg pulling part of this question. The mandibular nerve, from the main trunk you have a meningeal branch which is a sensory one, and the muscular branches they go to the medial pterygoid, tensor tympani and tensor veli palatini, they all originate from the main trunk of the nerve. Whereas the anterior division you have the mesenteric nerve, the buccal nerve which is the sensory branch, they are all the ones which come from the anterior division. Similarly, the branches which come from the posterior and anterior division, so you must know about the mandibular nerve. Now doctor, which is a direct tributary of SVC. In fact, in veterinary science, that is in the lower animals, you basically call azygous vein as the SVC of the lower limb. It is also called SVC of the lower limb because it directly, you can otherwise put off that this local speakers you can bring down. Online students, can you please punch whether the voice is loud and alright for you? Is there any issue with the voice? Now basal ganglia, from where does it basically develop, doctor? Neural crest derivatives is one of the favorite questions of the examiner. So the neural plate ectoderm, you must know what are the derivatives of the neural crest and the neural plate ectoderm, which are different from one another. So doctor, from the neural crest you have the sheath of the peripheral nerves, pigment cells, suprarenal medulla, etc., whereas the neuroectoderm, it is the one which gives rise to the various telencephalic, diencephalic, mesencephalic structures. Basal ganglia, after all, are the neuroectodermal derivatives of the telencephalon is what need to be remembered. What is the action of the anterior fibers of the deltoid is an important question. Honestly, very tricky question. We know what deltoid does, but not specifically what is anterior fibers is a little tricky part. Anterior fibers are involved in the shoulder abduction whenever the shoulder is externally rotated. They are also involved in shoulder flexion and they are also, you leave it, they are also involved in medial rotation of the humerus is what you have to ultimately remember, doctor. Now, oxygen dissociation curve, right shift or left shift is a very common question. So I am very happy every year APJUDA gives me an humble opportunity to review a question paper. Once upon a time the APJUDA students last year, a good number of them are our own students who were attending coaching like you, and they are the cream of Andhra Pradesh who topped the entrance and got into the MD and now setting up a paper, really good paper, excellent paper. So doctor, with the blood transfusion, when there is a change in the 2,3-DPG levels, automatically there is a shift in the affinity for the oxygen for the hemoglobin, and the oxygen dissociation curve will shift to the left, is what you have to basically remember. ANP does not cause the contraction of the mesangial cells, but norepinephrine, histamine, angiotensin 2, all of them are basically associated. You can't calculate residual volume using spirometry. Residual volume is a part of total lung capacity. So you can't calculate total lung capacity using the spirometry, is what you have to basically remember. Now coming to the secondary messengers, I think easiest question. They mediate the intracellular responses of the neurotransmitters. Oh, this is a beautiful question, doctor. Definitely there is no surprise if the same question comes tomorrow in the APPG 2014. So doctor, hormone sensitive lipase, it is an intracellular neutral lipase. Whenever we are having starvation, or whenever we are when the epinephrine levels are high, epinephrine stimulates this hormone sensitive lipase basically. Epinephrine, glucagon belong to opposition party, insulin is the ruling party. So insulin will do the opposite of that, that is, it causes the inactivation, not activation. Epinephrine, glucagon cause activation of the hormone sensitive lipase, is what you have to ultimately remember. So this is how epinephrine, glucagon basically will go act on adenylate cyclase, increase the cyclic AMP levels, which in turn stimulate protein kinase A, and that in turn will cause the hormone sensitive lipase to get into an active form, which is a phosphorylated form, and that lead to development of the conversion of the triacyl glycerides broken down into fatty acids. Fatty acids. What is insulin? Insulin is a lipogenic hormone. So it will do inactivation of the lipase. That is what you need to appreciate. One question on glycolysis, without that, whether All India Institute conducts MD entrance or APJUDA conducts MD entrance, it will be the definite sure shot topic. So doctor, phosphoglycerate kinase, you have substrate level phosphorylation. Succinate thiokinase, you have a substrate level phosphorylation. And you must know which glycolytic enzymes lead to substrate level phosphorylation. Definitely this question is going to come in the tomorrow's MD entrance. So one Nobel Prize, it has become a fancy for the state MD entrance to regularly ask about Nobel laureates. Kaun banega PG Pati. It is the James, Rothman, Schiemann and Thomas. They are the ones who have done a phenomenal work on the vesicular traffic in the transport system of the cells, is what you have to basically remember. Histidine is responsible for all the buffering which you see in physiological pH, which is not used for the aneuploidy detection. So basically aneuploidism, what happens doctor, the chromosomal number will alter. So what will you do? You have a quantitative fluorescence PCR, RT-PCR. They all basically are the laboratory tests to know how much DNA is there quantitatively. Is it increased, decreased, altered, how much? So they are all used in order to detect the presence of aneuploidies, is what you need to ultimately remember. Copper deficiency, Menkes kinky hair syndrome. This is known since ages, no big deal. Irreversible cell injury. What is the most pathognomonic feature? This was also one of the previous All India questions. Reversible, irreversible signs of the cell injury you have to study, doctor. So, severe swelling of the mitochondria, damage of the plasma membrane, swelling of the lysosomes with the leakage of the enzymes into the cytoplasm, they are all considered to be the irreversible signs, but the hallmark is presence of flocculent amorphous densities in the mitochondria. Why? If the mitochondria undergone damage, then it will initiate the process of the apoptosis by the release of the cytochrome C. So that is the reason it is considered to be the hallmark. Mitochondrial damage is the hallmark of irreversible injury, is what you have to ultimately remember. This is a formula question paper. Your state MD entrance will be more or less like this, because APJUDA's board of paper setters are all last year and last before years entrance toppers, so they know how troubled will be your mind and what are the minimum guaranteed topics you need to read. Chromosomal analysis of multiple myeloma. So doctor, T1114 results in the upregulation of cyclin D1. The most common translocation which you find in the multiple myeloma is what you need to remember. What does cryoprecipitate basically contain, doctor? Can our online students please add a feedback whether the voice is loud and clear, so that I can be little very sure about that your transmission is all right. Now doctor, cryoprecipitate, factor 8 fibrinogen, classical components, it does not contain any antithrombin. Ezopardes effect का मतलब क्या होता है, कभी सुना बेटा, नहीं सुना ना? Blood vessels in the necrotic areas, if there is a small cell carcinoma, they show the smudged hematoxyphilic material in their walls, which basically represents the DNA which is being released from the tumor cells, is what you have to basically remember. So thank you that Asha, Ashwin, Alok, Naina, everybody, the voice is loud and clear. What happened to the speakers? You can't do something for that? Try. Sokal's index. Where do we use Sokal's index? We use it for the CML, age of the patient, the spleen below the costal margin, platelet count. You can put it off. These are all the important criteria which constitute what is called as the Sokal's index. What is the effect of bradykinin? Do you need this? I think because of this you are getting the disturbance. You have another mic? Sure? We'll try with this. Yeah. Now just comment with this mic. Is the voice clear? Now you try the volume, slight volume. Now, what is the effect of bradykinin? Bradykinin is basically a vasodilator, not a vasoconstrictor, because it causes the endothelium derived relaxing factor release, which mediates the vasodilation, is what you need to remember. What is the surest sign of malignancy, doctor? Whatever that metastasizes is definitely malignant. MCV, mean corpuscular volume, is the one which represents the iron deficiency anemia, is what you need to basically remember. Otherwise you have the other regular mic. Our regular microphone has gone to Guntur for the lecture, so we need to navigate with this mic. Which is better one between those two? Now doctor, what is the main pathophysiological aspect of atherosclerosis? It is the monocyte, which is responsible for engulfing all that lipid laden macrophages are the ones which are the central part of the pathophysiology. Beautiful question. One question on glomerulonephritis invariably will be asked in exam. That is the deal between us. In HIV, we have what is called collapsing type of a glomerulopathy. So what is the hallmark of this? FSGS, which is of collapsing type, which is seen in retroviral patients, doctor. Typically, they have proliferation and hyperplasia of the glomerular visceral epithelial cells. They are getting some tapping noise. What happened? Those mics are working? Huh? Amplifier? Why amplifier was taken there? Your problem is with the amplifier or? Huh? Okay. It's not the new one, our regular one. You connect with that main one. No, it is noisy, they are saying. Now, is it clear for the? Okay, you put off the remaining mics off. Okay, same status. Okay, for online students, if it is clear, it's fine. Okay. Now doctor, the next question actually was wrongly framed. Those who have taken the paper, option was given as higher the LD50, safer is the drug as a wrong option, right? Higher the LD50, it will be safer. What is meant by LD50? It is the dose at which lethal effects will appear. If it is of a higher value, that means only at a higher doses lethality is going to happen. That's the reason it is considered to be a safer the drug. So that is the reason the correct option should be to make it a wrong statement, option A. Lesser the LD50, safer the drug, if you say, that is a wrong option. Okay doctor, one small correction. Was it given like this only in the paper? More the LD50 was given, no? So then it becomes a wrong option. Yeah, Once more, can the online students can punch? Is the voice loud and clear? Now, ED50 means what? The dose at which the therapeutic effect is produced in about 50% of population, you call it as ED50. Now, which one is called a peptibody? Any MD entrance you go, the deal is one question on monoclonal antibodies. Nowadays, there is a new way by which the monoclonal antibodies are produced. What is that new method? They are creating fusion proteins. Peptibodies, they are also called peptide FC fusions. They are a alternative therapeutic format of the monoclonal antibodies, where they contain the biologically active peptides grafted onto a FC domain, is basically called a peptibody. Romiplastin is used in the management of chronic ITP. It is a fusion protein analog of the thrombopoietin, a hormone that regulates the platelet production, and used in chronic ITP patients. Chronic ITP to treat is very challenging. You will be exhausted with all immunosuppressants. You used steroids, you used vincristine, you used every damn possibility, but still patients' platelet counts are falling. Ultimately, you will be forced to do splenectomy. ITP. And what is the paradox about ITP? In ITP, there will be no splenomegaly. Though there is no splenomegaly, splenectomy is the treatment of ITP. That is the paradox about ITP. Okay, doctor? Now, so this is a typical structure of romiplastin, where it's new way by which monoclonal antibodies are produced. GFR doesn't depend on what? Beautiful question. There is a pleasure in discussing APJUDA paper. Doctor, molecular weight, plasma protein binding, renal blood flow, they are all important for the GFR, glomerular filtration. Whereas what is one more thing that you have? Tubular reabsorption. For that you require lipid solubility, not for glomerular filtration. Okay, doctor? So, acidic drugs are excreted if you alkalinize the urine. Barbiturates, salicylates, sulfonamides. Alkaline drugs are excreted better if you acidify the urine. Classical example is amphetamine and pethidine, is what you have to ultimately remember. Then you have third important category by which drug is eliminated is called tubular secretion. Penicillin, probenecid, salicylates, thiazides, indomethacin, methotrexate, classical drugs which are basically secreted. What is the most potent statin, doctor? All remaining statins, you know, only one which you are new, even I am also new, is rosuvastatin, is a more potent statin which is basically available. What is meant by potency and what is efficacy? There is a difference, I think you appreciate it well. Debouquet number pseudocholinesterase, very standard question. Doctor, quiz question. Medullary bodies. Life is miserable with a lot of bodies in the microbiology. So these are the typical spherical yeast-like medullary bodies which are seen in the chromoblastomycosis, is what you are able to see here. Homocytotropism, इसका मतलब क्या होता है डॉक्टर? If you take the IGE class, it has affinity for the tissues of the same or a closely related species. It's called as homocytotropism, is what you have to ultimately remember. What forms do you see in peripheral smear? Beautiful question on malaria. Gametocytes, all of us remember. We should also know, we see early trophozoites, they are called ringiforms. Even they are also seen in the peripheral smear, is what you need to remember. Excellent question, doctor. Straight, the same question is going to come in the tomorrow's APPG. No surprise. Optochin sensitivity, bacitracin sensitivity, novobiasin sensitivity. 3 issues you have to be sure. I will give you a simple clue for you to remember. Optochin, optochin mein what do you have? P. Streptococcus pneumoniae mein kya hai? P. Don't tell Dr. Murali Bharadwaj teaches like this. Something for few unreasonable things which we have to temporarily remember and forget in our life. Streptococcus pneumoniae is optochin sensitive to differentiate it from all other alpha hemolytic streptococci like Streptococcus viridans. They are optochin resistant. Where do we use bacitracin? Pyogenes also has a P. P concept does not work. Streptococcus pyogenes from beta hemolytic streptococci. Otherwise you can remember B is beta, B is bacitracin. They were all alpha hemolytic, no. We are talking here what? Beta hemolytic streptococci to distinguish them from Streptococcus pyogenes which is found in the throat. We use what you call bacitracin sensitivity. Novobiasin is skin के ऊपर रहने वाला commensal Staphylococcus epidermidis from other coagulase negative staphylococci which are Staphylococci saprophyticus. Saprophyticus is resistant to novobiasin when you culture. Definitely one of these will come as a question straight in the tomorrow's exam, doctor, take it as my word. Epstein-Barr virus, classically it stays in the memory B cells. First carpal bone to ossify. If you did not answer this question, you are the most innocent PG aspirant in this batch. By this time clavicle का importance क्या है, capitate का क्या होता, fetal life में what do you see, ossification centers, everything must be ready and compliant for the exam. Capitate is the largest of the carpals and also the first to ossify. One criminal procedure code you must know before becoming a member of APJUDA, right doctor? So APJUDA. Forensic में CRPC codes are very common question, doctor. Classical question this is. Criminal procedure code 176, doctor, is a 174. What does it say? So these are all very important, especially whenever a woman has died within 7 years, husband is responsible. After 7 years, she herself is responsible. So first 7 years, like a new laptop warranty, husband should be careful to see that she does not commit suicide. Otherwise magistrate will ask why did she commit suicide, etc., etc. Danbury tremors, mercury. Disclosure of the rape victim, recent Ames question this is, 228A. Autopsy where en masse removal of the body organs is done. Letuli's method it is called as. Late expanding phase is birth rate is declining, sorry, birth rate declines but death rate declines more than the birth rate. Family planning is operating, but at the same time old people are living little longer. So that is the late expanding stage. So the birth rate, can you close the door? Randomized control trials may, this is a standard question in the MD entrance. Intention to treat analysis का मतलब क्या होता? Even those who are dropouts, you include them into analysis at the time of analyzing the data. You totally close some that cigar smell. Now, relapsing fever is what type of tick, doctor? Soft tick. high false positivity, whenever there is a low prevalence or a base rate, then it is bound to have a higher false positivity rate, is a very standard question in the epidemiology. So what is the formula of standard error of mean? If you know the formula, you will answer this question correctly. Divided by square root of n. More the number of people, smaller will be the standard error, because square root of standard deviation divided by square root of n is standard error. More the people in the denominator, smaller will be the standard error value, is what you need to basically remember. That's the reason the wrong statement is option C. APJUDA students remind me that black bag, yellow bag, red bag, without a bag you can't go to post graduation. You must know which color bag is what. Black bag, already we have seen various categories. Which type of bag do we use? That list, doctor, still we did not read and go to exam, means not good, because every mock test virtually without a bag color based question we are not sparing you. So yes, endemic ascites is because of pyrrolizidine, endemic ascites, lathrism, all these things you need to be quite sure, doc. 2011 census, if you are not prepared, be prepared to keep writing entrances until 2021 census. That is the dictum. Now, what is a goal, what is a target, what is a mission, what is objective? The most disgusting part of the SPM is in the last 50 pages of the preventive medicine book. So what is a goal, doctors? To become prime minister is the goal. What is the target? First, to win the election locally. So what you can measure is not a goal, unmeasurable is goal, right? So goal is a desired end result which are not measurable. Objective is the one which is measurable, is the fundamental difference which you need to appreciate, doctor. NRHM program, as I told you, ASHA, Janani Suraksha Yojana, NRHM, whether APJUDA conducts or All India Institute conducts, definitely a question will come, you must know the everything. So tomorrow you are going to take MD General Medicine. Managing a patient with hyperlipidemia is a day in and day out affair. So what are the diagnostic criteria of a metabolic syndrome, doctor? Central obesity defined by waist circumference, dyslipidemia based on triglyceride levels and HDL-C levels, blood pressure, fasting plasma glucose, they are the basis of the ATP3 guidelines. Maybe in your personal guidelines you are having LDL, but that is not in ATP3 guidelines. That is the whole issue of the exam. Constitutive pericarditis finding calcification, simplest question in the planet. Oh doctor, dirty question. Basically there are two forms of esophagitis, infectious, non-infectious. Where do you see large nodular defects resembling grape clusters? Candida esophagitis. Large nodular defects resembling grape clusters. Eosinophilic esophagitis mein what you find? Longitudinal fissures, concentric rings, focal white specks of abscesses. Very difficult to answer. Harrison internal medicine पूरा पढ़े तो फिर भी आप अंधा नहीं बने तो तब देख लेंगे that you understood this fact. But once more, excellent question, because to remind you, what you read doesn't directly always come in the exam. Tomorrow APPG when you take also, doctor, 200 questions may 30 questions require your stone throwing skills, good guessing skills, right? That is very important point to carry home. I am very happy to see Mahinder, Naina, Alok, Shaurabh, students of Guntur, Tirupati, Karnool, everyone being online. But it's a beautiful paper, let me tell you. APJUDA has done a wonderful work. There are 3-4 errors that's common in key and frame, but overall very qualitative paper. Velcro crackles, pulmonary fibrosis, idiopathic pulmonary fibrosis. It is a key for the early diagnosis of the IPF is what you have to basically remember. Oh doctor, this is a traditional question in the entrance. A, B, P, A. Minor major criteria padh ke jana padta, whether you like to take or don't like to take general medicine. Asthma, blood eosinophilia, skin reactivity to aspergillus, presbyterian antibodies, raised IgE, history of pulmonary fleeting opacities and central bronchiectasis. What was the recent question asked in the, which exam it was, Maharashtra or Comet K? Central bronchiectasis is one of the, or maybe it is in our mock test I think. Questions and questions. Every week about 500-600 questions revision karke hum, we are becoming old. Central bronchiectasis, don't forget ABPA, classical. Minor criteria, in sputum if you find aspergillus, if patient expectorating the brown plaques or the late skin reactivity are the part of the minor criteria. Transudative, exudative effusion, pleural effusion. Similarly, based on the SAG, SAAG analysis deciding what type of ascites it is, definitely question will be asked, doctor. If you escape these two, examiner will definitely ask about CSF finding in different forms of meningitis. ये तीनों fluids में एक ना एक fluid तो जरूर आएगा exam में, right? So you need to be the master. Uremia classically is an exudative effusion is what need to be remembered. Similarly, systemic inflammatory response versus sepsis, severe sepsis, ARDS. What are the criteria to define? Is a very important question, doctor. SIRS होता है abnormal body temperature, heart rate, respiratory rate, WBC count. It can be due to either infection or not, without infection also. For example, if you have a severe malaria or pancreatitis, you can have SIRS. If it is due to the infection, you call it as sepsis. If it is associated with hypotension and organ dysfunction, target organ, then you call severe sepsis. And septic shock is if there is a persistently low BP. So these definitions are the finest things that you need to be very clear about. Nowadays it has been a fashionable topic for the examiner. Acute kidney injury markers, lot of entrances they are asking this question. So doctor, Yengal, IL-18, cystatin C, KIM1, they are all considered to be the, and beta-2 microglobulin, they are all treated to be the important markers of acute kidney injury. Similarly, acute kidney injury may, what are the indications for biopsy? All these are the important issues. Similarly, nephrotic syndrome may, to everybody we give steroids generally. We don't do biopsy for nephrotic syndrome generally, but there are indications for doing biopsy before you start steroids in case of nephrotic syndrome. So what are those set of indications? That was a recent Comet K question, so you need to be very sure about. Beautiful question. Carney's triad, what is except? Today only I came to know Carney's triad is different from Carney's complex. Oh, mischievous question, right? So, epithelioid leiomyosarcoma, nowadays called as gist tumor. Pulmonary Chondroma extraadrenal paraganglioma, the combination is called Carney's triad. Whereas myxoma in the heart, hyperpigmentation of the skin and endocrine overactivity is called Carney's complex. They both are not the same. Kaplan syndrome is Kohlwerker's pneumoconiosis along with rheumatoid arthritis. You do not find any bronchiectasis there. Sjogren's may, basically what is Sjogren? Lymphocytic destruction of the exocrine glands is the hallmark, autoimmune destruction of the exocrine glands. It also has a component of joint involvement. It is similar to rheumatoid arthritis basically. So arthralgias are the most common extraglandular manifestation is what need to be remembered. Surest Sign, where do you see? What are you able to see here? Calluses on the knuckles. If a patient has got bulimia, what do? After eating a little they will start self-inducing vomiting. Because of that you have the calluses, right doctor? So tomorrow you are about to slip the engagement ring and you found calluses on the knuckles, do not suspect the girl's psychiatric state and run away from the wedding. So reading too much can lead to few problems. So bulimia nervosa, the presence of calluses on the knuckles. Excellent question doctor. Pulsus paradoxus reversed form. चलो पहला रिवर्स के गेयर में जाने के पहले रेगुलर पल्सस पैराडॉक्सस क्या होता है डॉक्टर? At the time of inspiration, what will happen? There is a negative intrathoracic pressure which will bring an increased venous return into the right side of the heart, which will press on the left side of the heart. It presses it so much that left sided output will diminish and hence the pulse rate will diminish, cardiac stroke volume will diminish, that is called pulsus paradoxus. Reverse का मतलब क्या होता? At the time of inspiration cardiac output should increase. If the सीधा वाला pulsus paradoxus decrease होए तो reverse होना है, अगर inspiration लिए तो cardiac output should increase. So where will you see that? Typically in HOCM. Why in HOCM? Basically in HOCM what is the problem? This is the left ventricular outflow tract into aorta. This is the mitral valve, anterior leaflet. So at the time of the ventricular systole, this mitral valve leaflet is touching the interventricular septum, due to which it is causing obstruction to the outflow. समझ गए ना? That is the problem in HOCM at the time of ventricular systole. Because of that left ventricular output decreases, cardiac output decreases. What happens with inspiration in these people? With inspiration, the preload to the heart will increase in inspiration, and because of that the left ventricle chamber size will increase and the touching will decrease, and that will increase the cardiac outflow. Hence at the time of inspiration what is happening? That is causing increased cardiac output. Got it? So that is the reason HOCM is considered to have reverse pulses paradoxes. With inspiration there is an increased cardiac output is what need to be basically remembered. I am very happy to see Anita coming online. That's good, doctor. Every evening we want to see you all. So nowadays we are having anatomy classes by one of the excellent passionate teacher in anatomy. I love to once more become a student. Dr. Muralidhar Reddy sir, rocking with the concepts every day evening. Maybe this is very untimely because your entrance is in March 2nd, but you can tell your juniors in the evening if they have time to take an opportunity to attend Muralidhar Reddy sir's anatomy class. Another 10 days he is going to teach anatomy. After that we have Dr. Reddy, one more Dr. Reddy sir from Kakinada, excellent physiology teacher. So he is going to teach physiology. Then now we are roping up nearly about 70 faculty across India. They may be in Punjab, they may be in Delhi, they may be in Mumbai, but they will reach your home every day evening 5 to 8 p.m. on onlinemmbbs.com. And every Sunday we will be there to discuss a mock test paper as usual. So this another 15 days when the state MD entrance happen, we don't want to see you back. You need to get the seat, you are going to join post graduation. But those who could not get time to prepare well, now realizing that probably we would have done better, still try better for another 2 weeks. If you happen to miss it, you are not alone in the world. We are always there to help you out for your preparation, but ultimately choose only the branch which you want to become without a compromise. That is the most important thing, doctor. If both noradrenergic and cholinergic system, one will accelerate, other will decelerate, the ultimate effect is which is more dominant type of innervation to the heart. It is the parasympathetic system is dominant. So whenever you block, it gets most affected. So that is the reason there is a speeding up of the heart. How much potassium is required? If you know only, you will answer. You don't know, hands up. 50 millimoles. Anti-Rho antibody is the congenital heart block. Absent seizures may, what will you not use? We don't use topiramate. Doctor, one question on anti-epileptics. APPG is not for 200 marks. AIPG is not for 300 marks. It is only for 30 marks or 50 marks. Why? Remaining 140, 150, definitely you can expect them. One question on carcinoma cervix, one question on antiretrovirals, one question on anti-epileptics. Without that there is no paper. So doctor, absent seizures may, ethosuximide sodium valproate is first line, alternative treatment is lamotrigine, adjunctive treatment can be a combination of them, but you will never use carbamazepine. This can be a favorite question. Actually option would have been carbamazepine, that would have been more interested. Topiramate out of elimination you will answer, but carbamazepine is a better option. Similarly, phenytoin, vigatrabin, tiagabin, don't give them in case of absent seizures. This is a standard question, doctor. Ankle knee jerks absent means areflexia, which is a sign of LMN. Plantar reflex is showing extensor means it is Babinski, which is a UMN. Where do you see combination of the two? Friedreich's ataxia. Even in vitamin B12 deficiency, even in Tavis dorsalis, even in subacute combined degeneration of spinal cord, but because ataxia is there, you call it as Friedreich's ataxia. Simple. But I don't fully agree with this. because a patient of vitamin B12 deficiency will also show the presence of ataxia, right. So if my students become the examiner, if I sit as a student, I have more points to argue, so that is the point. After seeing the quality of this paper, I feel better our students compose every week the mock test and we prepare and discuss the paper. That would be a much better paper than what we are composing, I feel. So if you take celiac disease, there is nothing which can be called a specific finding if you do biopsy. Still you will do biopsy. Why will you do biopsy? You find villous atrophy and other findings. But if you give them a gluten free diet and repeat biopsy, if the abnormal findings normalize, then you consider it as celiac disease. समझ में आ गया ना? For example, what is meant by specific finding? If you find cobblestoning, you concluded it is, for example, inflammatory bowel disease. That is specific. यहाँ तो क्या दिखाई देता? विलस एट्रोफी दिखाई देता सिलियक डिसीज में बायोप्सी करे तो. विलस एट्रोफी का causes ओ बड़ा लिस्ट है. But if you give gluten free diet and then if you happen to recheck, if the villus atrophy is vanished, then you consider it as celiac spray. So it does not show any specific lesions. That is the nature of celiac disease. Thiamine infusion शुरू किया, ataxia, ophthalmopathy, apathy, सब कुछ they will normalize, but not the memory loss, which is irreversible. Once more, doctor, I am very happy. Our students composed a wrong question. Printing error. Every week they will be ragging me that I have done printing mistakes, or there can be conceptual mistakes also, good number of times. The question that was given was HB less than दिया या greater than दिया? Less than दिया ना? अगर less than दिए तो what happens? Answer will become 1 and 2, both of them. So they need to do a correction by putting HB more than 10. That is a better choice, doctor. Now, so I leave to you in the literature International Prognostic System IPS for the Hodgkin's lymphoma क्या होता है? We will be uploading this explanatory booklet online, otherwise all these things are there in every textbook, no big deal. Mock test is meant to remind you what to go back to the books. Explanatory booklet is only a formality, let me tell you. Don't depend only on explanatory booklet. Morbidly obese person may functional residual capacity diminishes, V by Q mismatch occurs, but oxygen consumption increases but not decreases. There is changes in the respiratory system in the case of the morbid obesity. 25-year-old lady complains of acute hirsutism, means you will contemplate possibility of what? Adenoblastoma, ovarian androgenic tumor, that can be better diagnosed by doing dihydroepiandrosterone levels, blood levels is what you need to appreciate. MODY, which type and promoter factor 1 defect? It is like asking what is the national flag color, national bird of Argentina. If you know only you can. So वैसे क्वेश्चंस भी आते हैं MD entrance में. Don't feel sad that oral diabetes is a common topic. MODY is also known to be a high yield topic. Every time sir used to break his head to tell the same point. Let me tell you, you will lose also few questions in actual entrance on the topics which you read. You might have read diabetes, you might have not given much importance to the which promoter factor 1 defect is MODY 4, nothing to regret. So after reading also we lose about 10-15 questions. That is what I want to reinforce to you. MODY type 4 is insulin promoter factor 1. Theophylline toxicity mein what are the two options available? Hemoperfusion and there is a tachycardia, phosphodiesterase inhibition ke wajah se. So you do beta blockade. Dr. Harrison's 18th edition wala table wala question, very difficult to answer. Once more you need to guess. Interstitial nephritis में स्टीरॉइड्स देना या नहीं देना? आपको ग्लोमेरुलर नेफ्राइटिस मालूम है ना, ग्लोमेरुलर में पैथोलॉजी रहता. दूसरा चीज क्या होता? इंटरस्टिशियल ट्यूबुलो इंटरस्टिशियल इन्वॉल्वमेंट हो सकता. देयर आर ओनली टू थिंग्स इन किडनी नो. वो दो चीजें के लिए डीएम, दो लेटर वाला डीएम करना पड़ता, राइट? सो there is a list in the Harrison. What are absolute indication? 18th edition Harrison. Relative indications kya hota? If you answered this question wrong, don't regret, unless you are a super duper guy. Also you can't answer. It's a question of mere guesswork. Maybe drugs के वजह से उतना इंडिकेशन नहीं होगा बोल के कुछ अंदाज लगा के स्टोन मारे तो वो लग गए तो आपका नंबर आ गया. So that is what you need to know. This is a beautiful question. Renal tubular acidosis, diarrhea, they are the examples of normal anion gap metabolic acidosis. Fasting में अगर hyperbilirubinemia आ गया, exercise में आ गया, starvation में आ गया hyperbilirubinemia, think of Gilbert. Doctor, this is a beautiful question. Lateral medullary syndrome is associated with. I am going to take can you give me some water? 2 minutes of your time. See doctor, one question on brainstem syndromes, definitely it will come, right? You have to diagnose whether it is a lateral medullary, medial medullary, lateral pontine, middle pontine, dorsal midbrain, ventral midbrain. Named syndromes are there: Clot syndrome, North-Nagel syndrome, Benedict syndrome, etc., etc. So let's talk about it. The rule 4 of brainstem, don't forget doctor. If you take the brainstem, what is brainstem beta? Sana, midbrain, pons, medulla. It is a ground floor, first floor, second floor, G+2 structure which you are having. East facing G+2 structure, villa. There are 4 structures in the midline. Rule 4 it is called of brainstem. 4 medial structures. What are they? 4 M's you need to remember. M. What are the 4 M's which are medially located in the brainstem? Motor pathway, M means. What is the motor pathway coming from the brain to the spinal cord? Cardiacospinal pathway. You have a medial medullary syndrome means that cardiacospinal tract, since it is passing medially, it get affected, right? If it got affected in pons or where? In the case of the midbrain, on the right side, ultimately it will go to the left side of the body. Got it? So M is motor pathway, one medial structure. M is medial lemniscus. What is that medial lemniscus? Your touch vibration dorsal columns are there, no? They come to the medulla, you have gracile and cuneators, from there the fibers go up, that is called medial lemniscus. Lateral lemniscus has to do something with audition. Fundamentally, what is meant by lemniscus? Lemniscus is the second order neuron carrying pathway of the sensory system, whose final destination is to reach the thalamus. First order, second order, third order we have read, no? Second order sensory neurons traveling towards the destination called thalamus, which is the sensory, below the sensory cortex, next level. President sensory cortex है, वाइस प्रेसिडेंट होता है थैलेमस. थैलेमस के नीचे वाला रहता ना, फाइल लेके थैलेमस के पास ले जाने वाले, वो सेकंड ऑर्डर वाले रहता. उसको फाइल कौन देते? ऑफिस के बाहर खड़े होने वाले देते, कॉन्ट्रैक्टर देते. वो फर्स्ट ऑर्डर वाला होता. फर्स्ट ऑर्डर वाला को लेमनिस्कस नहीं बोलते. Second order neurons, which neurons? Sensory neurons traveling towards thalamus are called lemnisci. If it is the proprioception vibration, you call it as medial lemniscus. If it is auditory pathway, second order neurons going towards thalamus, you call lateral lemniscus. Okay na? Now, third, M, which is medially located, is the medial longitudinal fasciculus, MLF. Already we have seen what is the role of MLF. अगर आप किसी की ओर देख रहे हैं तो लेफ्ट साइड आपका लेफ्ट आई अपडेट होता और राइट आई एडिक्ट होता. कौन बोलेगा राइट आई को एडिक्ट होने के लिए जब लेफ्ट आई अपडेट हो रहे? MLF बोलेगा. And that connecting fibers are also medially located. Then fourth, M is the motor nuclei of the various nerves. So third oculomotor nerve nucleus is there, no? Third, fourth, they are the motor nuclei which are located medial part of the midbrain. Sixth cranial nerve's motor nucleus is located in the medial part of the pons. 12th cranial nerve's motor nucleus is located in the medial part of the medulla. 4 M's are medial structures. Okay na? Simple neuroanatomy ज़्यादा पढ़े तो दिमाग खराब हो जाता. You need to read what is needed. There are 4 structures which are located laterally which carry the S. ब्रेनस्टेम का स्ट्रक्चर के बारे में बात कर रहे हैं हम. What are those 4 structures laterally located in the brainstem carrying S? One S is spinocerebellar pathway. आपके पांव क्या कर रहे हैं, आपका नी जॉइंट क्या कर रहे हैं, आपका थाइस कहां है, वो सब दिमाग को मालूम होना पड़ता ना. So from your spinal cord, your hands are doing what, your chest is doing what, all that information from spinal cord is carried and made to reach the cerebellum through spinocerebellar pathway. इसलिए अगर lateral medulla में infarct हो गए तो क्या आएगा? Ataxia. You are not getting information what is happening to your legs, hands and trunk. Can you have balance? No. Ataxia due to spinocerebellar pathway, because S is located laterally in the brainstem. Second S, spinothalamic pathway is the second S. What is it carrying? Dorsal columns are carrying vibration. Spinothalamic tract is bringing information from the pain and temperature from the contralateral side of the body. So that get affected when the lateral medulla get affected. Sensory nucleus of the 5th cranial nerve. पूरा बदन का pain temperature is carried by spinothalamic tract. चेहरे के ऊपर अगर कुछ ठंडी हवा आके ब्लो हो गए तो that feel of the cold breeze touching the cheeks of you, how will you know? The pain temperature of the face is carried by sensory nucleus of the 5th cranial nerve. But what is the difference between the pain and temperature of the body versus pain and temperature of the cheek? It is not decussating. राइट साइड वाला चीक का पेन टेम्परेचर राइट साइड वाला सेंसरी न्यूक्लियस से ऊपर जाएगा. So lateral medulla get affected means pain temperature of the ipsilateral side of the face get affected, but contralateral side of the body get affected. That's what you need to appreciate. Then your sympathetic pathway. आप नाराज हो गए किसी के ऊपर, you need to become emotionally strong and shout at somebody on the top of your voice. Your sympathetic system should start its journey from hypothalamus. It has to descend through the brainstem and reach the cervical plexus. So that is the reason lateral medullary syndrome में क्या होता, spinothalamic tract get affected and you will get hornets because of that. So 4 structures which are located laterally, which are starting with the alphabet S. Then doctor, in medulla you have 4 cranial nerves. You agree with me? 3, 4 midbrain, 5, 6, 7 pons, 7, 8, 9, 10, I'm sorry, 5, 6, 7, 8 pons, 9, 10, 11, 12 medulla. You know very well. So you need to remember, among the cranial nerve nuclei, 5th, 7th, 9th and 11th cranial nerve nuclei ka motor part is located laterally. 3rd, 4th, 6th, 12th cranial nerve ka motor component nuclei are located medially. But if you know this, you know any brainstem syndrome. Rule of 4. Again, now you know if lateral medullary syndrome happens, what happens, medial medullary happens, what happens, anything you can play the dance. Right, doctor? That's right. 2 minutes will be out of video to take a backup. Anita is saying, sir, class is making me tense. I think she mistake to type intense. Intense. So, yeah. Alok is asking for notes. Please upload this into the Edmodo. Ask Alok to download.